Hello, everyone. I am Yolanda Harper. I am going to see if I can share this video, and maybe not. Let's see, where are we? It is Thursday afternoon, and I am joined today by my good friend Tera Ritchie, who is a nurse practitioner. Here we go. Let's share. Sharing is caring, guys. Awesome. So, Tera and I have known each other for a long time, right? We have been friends for a long time. Years, decades. Yes. So we knew each other in church days and child rearing days.
We've launched babies together.
We've launched babies together. Those babies are launching into college now together. Yes. It's been a lot of years. And then Tera and I have had similar journeys as far as returning back to school and entering into new professional lives.
Reinventing ourselves.
Yeah, it's been really cool. It's been really cool for us to have each other along that journey, and then for me to watch you and the work that you do. So Tera is a nurse practitioner, and over time we have had some conversations with one another about the work that we do and some of the concerns that we have for our community and well-being and health and all of that kind of good stuff. So since we've been talking so much about anxiety and some things that can be helpful for anxiety, I asked Tera if she'd be willing to join us today to talk about the use of medication for anxiety.
Definitely.
Right? And so she's a great sport and a great friend, and she's here.
And here I am.
And here she is. So thank you.
Yeah, thank you for having me. Thank you for having me.
Yeah.
As Yolanda said, I'm a nurse practitioner. My specialty is adult primary care. So that means I see a lot of anxiety in my practice.
Yeah.
I would say probably not a day goes by that I don't see somebody who has anxiety or depression or something similar.
And can I this is my little secret for the medical world. My preference and what I tell people is always as medical providers, nurse practitioners are near and dear to my heart, who I seek out for my own medical care because they have a very holistic school and training and the way approach.
Right. We try to look at the whole patient. What's happening in work and relationships, medically. So it's just a combination of everything. So trying to take it all into consideration.
Yeah. And you do
really
a good job
important.
with that. Yeah.
And it's all about listening, as Yolanda knows. It's all about listening so that you can help your patients. But again, a lot of people don't know where to start when they're dealing with anxiety.
Yeah.
So I always say, start with your primary care.
Yeah.
That's a great place to start. If they feel like there's something else going on, they can always refer you out. But primary care providers treat a lot of anxiety.
Yeah, and that referral out would be to a psychiatrist.
Right.
But I think a lot of people kind of generally think that they need to start with a psychiatrist, and that's not the case,
that's not the case.
That's a great for kind of day-to-day anxiety, depression.
Yes.
Primary care is important.
Yes, and that's where I think you should start.
Yeah. So how do you know when you're meeting with someone if they would benefit from medication?
And again, that's about the conversation. So just listening and trying to figure out how big is the scope of the problem. Is this somebody who has been in therapy? They're doing all the lifestyle things that you've talked about. They're doing all those tools and it's still not enough. Is it impacting their relationships? Is it impacting their work? Is it impacting their parenting?
Right.
So when everything else is not working, you're doing the best that you can, but you're still battling this overwhelming sense that something's wrong. You just can't get out of that fight or flight response, and you feel like that day in, day out, then that's when we need to probably talk about medicines.
Yeah. And I know for a lot of clients, their initial experiences are kind of very much somatic and very much a concern, like there's something wrong medically.
Right.
So can you speak to that?
Yeah,
experience.
That's one of the questions.
Having a heart attack.
Yes.
Or, because that's usually what we hear, right?
Yes.
Yeah.
A lot of people end up in the emergency room thinking they're having a heart attack, and it turns out to be panic. But what I tell my patients is that I want you to go. I want you to get evaluated. If you feel like there's something happening, get checked out. Go see your primary. If it's urgent, go to the emergency room. Because people with anxiety still can get sick. They still can have heart attacks. So I tell my patients, we are going to assume it's your heart or something else until we know otherwise. And once we've ruled out those things, then we drill it down to where, yes, it could be anxiety. And then we talk about how to deal with that. And the flip side is also true. Don't always just chalk up everything to anxiety. Right?
Sure.
Every symptom that you're having doesn't necessarily come from the anxiety. So talk about what's going on. And that's why that conversation is so important. Because, again, anxious people also have other things going on. So we need to make sure medically everything is good. And if everything is good there, then we can drill down and treat the anxiety.
And that's where I think, our styles and the way that we operate complement one another. Because when people come in here, one of the first questions we ask is, when was your last medical checkup? Right. And did you get the all clear from your medical provider? And we have to rule out things like thyroid disorders. I was about to say, because those things very much impact and can mimic some of these other symptoms of mental health.
Absolutely. So I think, what can you expect in starting those medications and having that conversation again is really important. Treating the person who flies twice a year and is anxious about that is very different than treating that person who's been that worrier, that anxious person since second grade. So that's going to be very different in looking at it. So the scope of the problem really helps us determine where to start with medication. And you have to look at everything else that's going on medically as well. What other conditions are there? What other medications are you on? Those sorts of things. So usually we have that conversation. We talk about the options. And the symptoms do guide choice, medication choice.
So tell me more about that. What symptoms are you looking for when you're talking about anxiety and starting some medications?
So we look at, is it the physical symptoms? Are you the person who's doing some public speaking and you're getting up in front of someone and you flush and you sweat and your heart races, you have the dry mouth? That's a very different treatment than the person who is just day in, day out, just running in fight or flight response. So that factors into how we choose those medications.
Well, and that kind of goes into, like, how is it impacting your daily life? Most of us are not giving, big presentations and talks every day, right? So we can manage that differently and maybe use the medication differently if there is medication, right? So if someone is in a chronic state of fight and flight, and that does take a toll on the body, right? So then what is the process from there?
So then we talk about the options, and probably the ones that you're most familiar with are the SSRIs. These are your selective serotonin drugs. They basically allow serotonin to be more available to the brain. This is the chemical that keeps your mood stable, that helps get you out of that fight or flight, helps you deal with stress. So you'll recognize a lot of those medications. This is Zoloft, Prozac, Paxil, Celexa, those types of drugs.
Yeah, and we've been talking a lot about anxiety in the nervous system. So these are the medications that help to down-regulate that fight or flight, the sympathetic nervous system, and help to up-regulate the parasympathetic, the calmer.
Exactly. Yeah. So they work primarily on serotonin. So those are the main ones. Those are first line. That's usually where we start for someone who has day in, day out chronic anxiety.
So those are the tried and true ones that maybe have the lesser amount of possible side effects.
And I'll just speak briefly to those. Every drug is going to have a little bit different profile, but I'll hit the big three that everybody worries about. So number one, starting out, upset stomach, always in the beginning. And the reason being is that you have a lot of serotonin receptors in your gut. So when you take this medicine, it stimulates those. So you can feel a little nausea, you can feel a little diarrhea. That usually goes away in the first week or two. Once your body adjusts, that typically goes away. Everyone reads the label and says, oh my goodness, I'm going to gain weight. It's not that simple. I still tell folks that you have control over what you eat, how much exercise you're doing. So it's not going to magically just pack pounds on you.
So it's something that you're mindful of. You're mindful of your eating, and you're mindful of the way that you move your body. And
the third one that everybody worries about is sexual side effects. And that can be an issue. And again, I find It's about having that conversation with your provider and knowing ahead of time that, hey, this is a potential, so we need to talk about it if it happens.
Okay.
And what I usually tell folks is that most of the time, as your body adjusts to the medicine, those go away as well. If not, if it's a deal breaker, we'll try something else.
And so what is the time frame that you're kind of keeping track on these potential side effects of the medication?
So when I start someone on one of these medicines, I usually follow up in about 3 to 4 weeks. So we do a follow-up appointment. At that point, most of the early side effects are gone.
Right.
And we'll know if we're heading in the right direction.
Okay.
You should start to see some improvement. But what I tell people is that other people will notice it before you do.
Okay.
So maybe your spouse or maybe a coworker will say, hey, you seem like you're feeling a little calmer. So that 3 to 4 week mark for me is just to see, are we on the right track? Is this the right medicine?
Okay.
And how are you tolerating it?
Okay.
If not, if the side effects are a no-go, we just can't get past them, then we try something else. And I also remind people not to get discouraged. Sometimes we have to try a couple of different medicines before we find the right fit.
I think that's so important because I think that there can be kind of this assumption or hope or what have you that, man, like this anxiety is killer.
Right.
And I'm just going to go in, I'm going to get the prescription, and then everything's going to be better.
Right.
And it
that's
is a
not the
different,
case.
it's a process, just like anything else, right? Just like
Exactly.
therapy, just like, wellness and exercise and all of these things, right? It takes some time.
It does take some time.
Yeah.
So after that visit, once we decide are we on the right track or not, usually it's about a 2 to 3 month follow-up.
Okay.
At that point, that's as good as it's going to get on that medication.
Right. So then there's the assessment, like are we, is this
on
the
the
good
right
one,
track?
right? Do we need to consider some other options?
Maybe we adjust the dose,
Okay.
Or maybe we add a little something to it. Sometimes we can add medicines together to get a little bit better response. So again, it's about that conversation.
Yeah.
So the SSRIs, that's the process there. There's a couple of other drugs that I'll mention.
Yeah.
The SNRIs, these work on serotonin, norepinephrine. These are Cymbalta, Effexor, those sorts of things. I use those in more specific instances. Cymbalta, for example, someone who may be dealing with chronic pain, fibromyalgia, it's a great option for them to cover 2 bases.
Yeah.
So that's an option. Side effect profile very similar to the SSRIs.
Yeah.
Then there's a medicine that kind of sits by itself called buspirone. It works on a very selective piece of serotonin. And it also triggers a little bit of dopamine. So that's a good one as well. This medication is strictly for anxiety, whereas the SSRIs, SNRIs also treat depression.
I was going to say, as you're listening, you might hear these medications and you might be thinking like, wait a minute, I thought that was like an antidepressant.
They
right?
are. They are.
Yeah.
But several
medications can be helpful, right? And like you said, addressing chronic pain, which is also connected with depression and anxiety, right? Yeah.
So we use these medicines for a variety of things. And the buspirone specifically for anxiety. So that's Buspar by the brand name. I have good success with that, with anxiety.
Awesome.
I actually had a patient say, I don't remember that I have anxiety.
Oh, wow.
So, and we'll talk a little bit about those expectations as well.
Yeah.
And then finally, I just want to touch on the short-acting medicines. These are your benzodiazepines. People have heard of Xanax, Ativan, Valium, clonazepam. These have a role sometimes for certain patients. These medicines, if I see someone who is really, really overwhelmed with their anxiety, sometimes I'll use this in the short term as a bridge until these medications kick in and become effective. So this is your break glass in case of an emergency medicine. When you're tipping over the edge, you're getting into that panic attack mode, you can't bring yourself back. That's what these are for.
Yeah.
They work well for that, but they also have some problems that you have to be really aware of.
Right.
There's problems with tolerance, meaning over time they stop working as well.
Right.
It takes more and more to get that same result. Then we run into problems with dependence, to where you feel like you can't function without it.
Right.
And then
so
also,
especially if people have a history.
Yes, addiction.
Right.
You can become physically addicted to these medicines. So again, it's a really sparingly as needed as a bridge. It's short term. And there's some concerns with long-term use of those medicines as far as memory disrupted sleep cycles and things like that. So I would say approach these medicines with caution.
Yeah, not to be alarmist, just,
they have a place. But again, I always say exercise caution with those.
And I would say, too, just from a mental health perspective, typically when we are talking about that category of needing that category of medication because of the intensity of the symptoms, and that's beyond your day-to-day kind of anxiety, right? Fret, worry, stress. We're talking in those situations, there's much more of a likelihood of some underlying trauma, some of those things going, some more in-depth, intense kind of mental health things going on.
So, as I mentioned earlier, the person who flies twice a year, you know, and has a real fear of flying, that's a great place where Xanax has an effect. They don't need to be on medicine every single day.
Right. They can take it the day of the flight.
Exactly.
Or they can use some accelerated resolution.
Absolutely. You know, and then the person, like I said, who's sitting in front of my office, they're crying, they're trembling, they are really just hitting that proverbial wall.
Right.
That's when we need to step in and use those medicines. But again, sparingly.
And so, and part of this conversation too is let's start having this dialogue and let's start connecting with our providers before we reach that stage.
Yes.
Right?
Yes.
Right? Can we, as you start to notice, man, my sleep has been really off. Man, I've been finding myself more irritable. Right before you are
try to come see us before you get to that place where you're curled up in the corner and you just can't function because then we are in crisis of trying to figure out how to help you.
And none of us want that for ourselves or anyone else. We don't want that for our clients and our patients.
Yeah. Exactly. Another great question that I get is, how do you know if the medicines are working? So we talk about expectations, and again, it takes time to get into effect, takes time to get into your system. So what I tell people is that, you know, you're going to feel just a little more normal like yourself, right? You're not going to be skipping down the road and singing Kumbaya every day. That's not real expectation, right? But you should just feel a little calmer, a little more in control of your emotion, right? Not flying off the handle, not snipping at every little thing. You should just feel a little bit more in control. Your family members should say, hey, you didn't freak out in that situation. I noticed that things are really improving. So
these are not magic pills. I mean, there's no magic bullet with medication or, you know, with starting. I was saying to a client this morning, like, I keep meaning to order my magic wand off of Amazon, right? So that we can and everything's better, right? Yeah.
And I also ask patients, what are you hoping to get from therapy? What does this look like for you? That you are able to function and cope. So it's really about talking about goals and setting expectations.
Yeah. That's so important to have those conversations with your providers.
One of your followers asked about supplements, vitamins, which is always interesting, and everyone is always interested in the natural routes and things like that. And I do think that there's a role for some of those. There's a great website I want to get to called the National Center for Complementary and Integrative Health. This is a place where every study on every supplement and herb is published. So if you want to know, is there any data to support this, it's there. So a couple that I found, chamomile might be effective. Melatonin may be effective. Lavender, maybe. There's nothing that has a robust recommendation. So not a whole lot out there as far as that goes. But again, part of the conversation I have, it's a three-prong approach when I'm treating anxiety. It's lifestyle. So if you are sleeping 2 hours a day, living on Red Bull, strapped to your desk chair, staring at a computer, you're going to feel anxious.
Can we have this conversation? This is why I wanted for Tera and I to have this conversation, right?
It all
There's
starts
not,
there.
I mean, you have this wonderful, resource of the medications, right? But that's not going to undo your lifestyle, right? Sleep is important. Nutrition is important. Moving your body, all of those things that we don't want to recognize and acknowledge are important. Those things, they matter. You and I have an ongoing practice of well-being, right? We do yoga together.
Yes, we do.
Right? And we try to make good, we encourage each other with healthy food choices and healthy lifestyles, right? And sleep is so important.
Sleep is so important. So, that's where I always start. That's usually my first approach is let's talk about the day. What does your day look like? Let's talk about some things that you can do. For anxiety, I also always recommend counseling, because I find that cognitive behavioral therapies, some of the things that you do here with art therapies, those things are really complementary and great when it comes to anxiety.
Yeah, right.
And interestingly, then medicine is always the third prong, right?
Yeah.
That's not always where we need to start.
Right. And oftentimes, we're big proponents of holistic and wellness approaches, but we also recognize that medication absolutely serves a purpose. Yeah. And there's a lot of studies that do indicate like a combination of counseling and medication can be super effective, but also recognizing that the medication doesn't necessarily have to be the first part of the prong, right? And as far as the accelerated resolution therapy, like I've time and time again had clients say that that's as calming for them as using the medication or some other illegal substances. So.
Right. Medications treat the symptoms. They don't deal with the underlying issues.
Right. Those don't go away.
They don't go away just because you're on medication. So it has to be that three-pronged approach.
Yeah.
One without the other.
Right.
It's
like the three-legged stool, right? You get wobbly if you don't have one of those legs. Okay.
Exactly.
Yeah. So there are some complementary things that we can kind of add on, right? As an add-on, as a bonus. Okay.
Exactly.
Yeah.
I had one other good question that came in. Said somebody who's been through therapy has some tools during the rough times like holidays. How do they deal with family who always, pushes buttons and that sort of thing? Are medications an appropriate option for that? Sometimes, yes. Sometimes that may be where we pull out some of those short-term medicines if it's a really, really stressful situations. But what I really encourage people to do is pull from that toolbox. Anticipate this is going to be a busy, hectic time. Try not to overschedule yourself.
Right.
Take extra good care of yourself. Keep up with your exercise. Try not to eat all the Christmas cookies and things like that.
Yeah, some of the lifestyle. Get some sleep, right?
Make sure you're
exercising.
Manage your expectations. If you're expecting a Norman Rockwell holiday dinner, it's not going to happen.
It doesn't happen.
Just tell you right now, it's not going to happen.
It doesn't happen for any of us.
So manage your expectations. Pick out the things that are super, super important to you and your family and focus on that. Let all the extra stuff go.
Yeah. And that's a good time for conversations about boundaries. Something that
Exactly.
we will talk about, the
Yes.
boundaries and anxiety and how those go hand in hand.
And I tell people too, schedule time for yourself. Spend some time by yourself, retreat to your bedroom, read a book, listen to some music. So schedule some downtime, because I think it's too much togetherness that really becomes the stressor.
Well, and when we're looking at it from a brain and a nervous system, right, then we are just in a situation where our nervous system is being upregulated, right, heightened state, right, and then we wonder why things fall apart when we reach our upper threshold.
Exactly.
Yeah.
Exactly. So that's a good time to practice the self-care that Yolanda talks about. It's a good time to work on those coping things. There's probably some boundary setting that does need to take place, especially, with that one difficult family member, right? So those things are important, but manage your expectations, schedule in your downtime, keep up with your exercise and all those things.
Awesome. So, guys, thank you so much.
Yeah, you're welcome.
Tera.
I'm glad to be here.
This was so helpful.
Yeah, thanks for having me.
Guys, give Tera a thumbs up. Let her know that we appreciate her expertise in this. And let us know what other questions you might have that we missed. You can drop a comment here. You can email us at info@harpertherapy.com. If you would like some more information about anxiety and some tips and tools for anxiety and managing it, visit our website. Otherwise, you guys have a happy Thursday, pre-Friday.
I know, it's
almost
the
there.
weekend.
Have a good one, guys.
Bye.